K.W. Krieger presents The Obscura Dossier, Episode 10, The Unseen Machinery. Statement of Dr. Adrien Halifax regarding an extended series of unsanctioned surgical procedures and observed anomalous physiological phenomena, given July 9th, 1994. Statement taken from a typed document recovered at an abandoned medical clinic in Newark, New Jersey. Statement begins. It didn't start with an obsession. Not exactly. You'd like to think there's always a moment, an inciting trauma or discovery, some wretched instant you can point to and say, that's when everything changed. A clean incision, if you'll forgive the analogy. But in my case, no. There was no moment, only the slow creeping itch beneath the skin. I was always a child of discipline, of study, of clean hands and sharper instruments. My interest in the body was never romantic nor noble. I did not dream of healing, or the Hippocratic Oath. No, I was drawn to anatomy by something else entirely. Not curiosity, not even morbidity. There was simply a need. Cold, consuming, quiet. A compulsion to understand what makes us fail. What causes the meat to sour. The joints to seize, the organs to betray. What lies beneath the smiling mask of the human face once you peel it back and find only cartilage and rot? I remember sitting in lecture halls, the scent of formaldehyde clinging to my clothes like a second skin. I remember how the others would wince at that first cut, how they whispered about the sanctity of life and the privilege of care. I said the words too, of course, learned the cadences of empathy, but it was always just mimicry. Beneath the performance, I was already listening to something else. A rhythm, a calling, if you will. There was something wrong with the body. Not just illness or injury. Wrong. As in fundamentally flawed. Something in the construction. The very shape of it, as though we were unfinished. A failed draft of something purer. Something more honest. My mentors praised my technique. Said I had a surgeon's touch. Steady. Elegant, precise. What they didn't see was how hard it was to stop, to leave the muscle closed, the vessels tied, the patient intact. Every incision was a study, each movement of the scalpel, a question answered in tissue and tension. I never found it difficult, only methodical. There was a rhythm to the work, a structure, order beneath chaos. I found comfort in that precision. The way muscle parted predictably, the way veins resisted and yielded with familiar pressure. I began to dream of the theater, Not in metaphor, I mean the surgical theater, bright and cold, humming with sterile light. In sleep, I would find myself mid-procedure guiding the blade through a sternum, exposing a quivering heart or teasing a nerve from tangled fascia. I never remembered the faces of patients, only the steps, the protocols, the process. I considered it an extension of my training. The brain processes what it repeats. I had simply conditioned mine to repeat the cut. I told no one. There was no need. It wasn't troubling, just routine. I woke calm, rested, sometimes even with ideas. A better angle on a subcostal incision. I thought about layered suturing that I hadn't consciously considered. Useful, if anything, efficient. My supervisors noticed my focus. I was precise, tireless, always the first to volunteer for postmortems, always eager for rotations others found unsettling. Trauma surgery, oncology, anything that revealed more of the body's interior. I wasn't just chasing prestige. I just found something deeply orderly about the body under duress. I still do. They said I had a gift, that I was built for it. I didn't argue. They weren't wrong. I completed my studies with that incident. Columbia first, then New Jersey Medical School. Both institutions served their purpose. Frameworks in which to refine technique, to deepen anatomical knowledge. I absorbed everything with ease. Cadaver work, surgical theory, pathology. There was no mystery to it. The body is not sacred. It is not even particularly complex. It is simply layered. I excelled not out of ambition, but function. My detachment was mistaken for discipline, my silence for humility. I kept my hands steady and my opinions to myself. The faculty recommended me highly. The other students tolerated me, I think. But I was not there to be tolerated. I was there to prepare. When I began practicing, I did what was expected. I soothed, I listened, I wore the mask. My words were gentle, rehearsed, my hands always careful. Patients trusted me. There's something about a calm voice and still fingers that puts people at ease, even when they should not be. I did not resent the performance. It was necessary. A kind of social anesthetic. But beneath it all, the work itself, the act of it, that was where I felt most present. It was clean, honest. The body offered no lies once opened, no small talk, no abstractions, just process, muscle, organ, failure. The first time I stood alone in an operating theatre, I felt nothing. No nerves, no elation, only the anticipation of incision. A 75-year-old male, cardiac irregularity, routine. I remember my assistant remarking on the man's age, calling him a fighter. I remember nodding, agreeing, but I was thinking about the pulmonary valve, how it might feel beneath the scalpel, how much resistance I would encounter. I remember thinking clinically how easy it would be to press too hard. I didn't. Of course not, but the thought remained. Not disturbing, just there. Like an option on a menu you never intend to choose. But you still ignore it. You remember it, and the next time, it's a little easier to picture. I kept performing, day after day, case after case, prescribing, suturing, comforting, but the theater lingered in my mind long after I left it. The angle of the overhead light the resistance of skin, the subtle differences between living tissue and the cadaver's stillness. I would replay procedures in my head at night, sometimes improve upon them, sometimes modify them. I thought of it as a professional diligence. And yet, there were moments, fleeting, small, where I caught myself lingering a beat too long over a particular incision, noticing the sound of flesh parting, the warmth of blood as it traced its path along my glove. These details began to occupy more of my attention than I ever said aloud. I still completed the work, flawlessly even. But something had shifted. I found myself wondering less about how to heal and more about how the body chose to fail. The first deviation wasn't dramatic. A standard operation I'd performed dozens of times. Elderly male, arrhythmia, possible occlusion in the left pulmonary artery. The procedure itself was simple, predictable. The body offered no surprises until I gave it one. I don't know what made me do it. That's the question everyone likes to ask, isn't it? Why? As if motivation is a useful measure, as if decisions always arrive with labels. But it wasn't a decision, not really. It was a thought, a possibility, and I followed it. The movement was imperceptible, a shift in pressure, a slight delay in clamping, something no one else in the room would have noticed, something that could be chalked up to surgical complication, a regrettable outcome, and a common risk. He died, of course. On the table, blood loss. Rapid. The team responded with urgency, then solemnity. The monitor's tone flattened. There were no recriminations, no accusations, just silence. I delivered the post-mortem report myself. And then I went home, ate dinner, slept. I felt nothing. Not guilt, not pleasure. Nothing, just the memory of it. The moment the artery gave way, the heat of blood under gloved fingers, the sudden stillness in the chest cavity. I replayed it over and over, searching for something, anything. I found only process, precision, perfection in a way. That was the first time I understood what I had been circling around for years. Control. The body resists us in life. It sweats, it flinches, it disobeys, but on the table, under the knife, it yields, it answers, it reveals. For all the talk of healing, of care, what we do in the theater is closer to revelation. The body cannot lie to you once opened. There is only truth there, red and wet and silent. I did not seek out another mistake. Not right away. I continued my work with care and skill, with all the outward signs of competence, but something in me had shifted. Not broken, but refined. The mask I wore did not crack, it simply fit better. The temptation grew quieter but more constant. It no longer shouted, it whispered. At the end of each procedure, as I washed my hands, I would wonder, what would the next one teach me if I let it? What could I see if I allowed it to show me? The questions were not disturbing, they were methodical. And the answers? They were beginning to feel inevitable. Of course, it didn't happen all at once. Sanctioned cases continued, routine surgeries, consultations, quiet assurances to the dying and their families. I maintained every appearance, and the mask held. No one questioned. But it wasn't enough anymore. The problem with clinical medicine is its restraint, its limits. So much is off limits, ethically, legally, even physically. A patient's body must be preserved, protected, kept alive. That is the foundational lie of the profession, that life is the goal. But life is crude, unstable, noisy. I wasn't interested in life. It was in the early hours of a bitter March morning that I met him, an anonymous figure that was collapsed near the alley behind my clinic. Malnourished, delirious, barely conscious. A composite of disrepair. His breath rattled and his eyes didn't focus. No one else saw him, or more accurately, no one else wanted to. So I brought him inside. He never asked questions. I don't think he could. Whatever was left of his will had been burned away by years of neglect. He followed my instructions, ate what I gave him, slept when I told him to. A blank slate, untouched by anything except ruin. It was not pity that moved me. It was opportunity. I began with the smallest things, superficial procedures, tissue samples, rehydration, observation. I kept records, photographs, metrics. I justified it all, internally of course, as research. A study in resilience, adaptation, biological persistence under stress. But eventually I stopped pretending. I moved deeper, beneath the skin, into the bone. I made incisions, not for the purpose of healing, but for the purpose of understanding. I grafted, restructured, removed, and reattached. I wanted to know how far the body could be pushed, how long it could be kept conscious, what pain did to blood pressure over prolonged exposure, how the nerves responded when rerouted. He screamed at first, of course he did. A body screams. That's one of the few constants, but screaming fades. Eventually, he made no sound at all. I noted this with interest. Days bled into weeks. I operated at night, sterilizing my tools by hand, tracking changes in tissue elasticity and involuntary muscle contractions. He never attempted to escape. Or perhaps he just no longer remembered how. I don't remember everything I did to him, not precisely. I was too focused, too absorbed. The procedures blend together, became recursive. Each incision revealed something new. Not just structurally, but something else. There were moments when the tissue didn't behave as expected. Veins that shifted, muscle that seemed to resist incision. Not contract, but resist. There was a tremor once. The table shook. I thought it was an earthquake, but nothing outside moved. Only him. Only the body. I recorded it and wrote that the tremor may be neurological or stress-related, and that further observation was required. But I remember that moment more clearly than most. Not because of the movement, but because, just for a second, I felt as though he wasn't the one on the table. I was. There was a moment sometime in the 3rd month when I realized I had stopped documenting entirely. The notes sat untouched, the photographs were unwritten. I still went through the motions. I prepared tools, disinfected the room, calibrated lighting, but the observation was no longer external. There was nothing to write down. What I was learning couldn't be recorded, it had to be felt. The body no longer responded the way it should. Scar tissue dissolved overnight. Sutures were found missing in the morning. Once I returned to the room to find the man, standing, unsupported. His rib cage had been opened 12 hours earlier. He didn't speak, he just watched me. I didn't ask him how he was still alive. I didn't ask anything, I just sedated him, cleaned the incision, and continued. I never questioned it. Why would I? There was something else, something I couldn't name. Not then, but it was in the meat. It had always been in the meat. I think I had always known on some level the tremors, the resistance, the dreams. Oh, the dreams. They changed. They no longer showed procedures, not exactly. Instead, I dreamed of structures, vast halls of tendon and bone, organs suspended like chandeliers, great lattices of nerve stretching off into blackness. I moved through them with reverence, not fear. I was guided, welcomed. I would wake with the taste of blood behind my teeth and the smell of something metallic on my skin. It no longer disturbed me. The body on the table, he was changing. More than I changed him, his skin began to thicken, pale and slick. The musculature warped. He twitched when I wasn't touching him. Once he opened his mouth and something like a sound came out, but it wasn't a voice. It was a pressure, a sensation. I felt it in my molars, in my spine. I bled from my nose for 20 minutes afterward. I logged it briefly. Vocal abnormality, non-auditory resonance, possible intracranial response. I don't think I slept that night, not out of fear, but from anticipation. There was something underneath it all, not metaphor, not psychology, something in the body, in every body, something that remembers a shape that we've forgotten, that wants to be seen again. The incisions were revealing it, like scraping away paint to find the original icon beneath. And I was no longer just observing it, I was facilitating it. I began to dream of myself on the table. I saw my own sternum split open like a flower. I saw my spine unwind like a staircase. My hands worked on me with impossible precision, pulling my ribcage into new configurations, and I did not resist. I woke smiling. I don't know how long he lasted. The body, I mean. Time lost shape in that room. Days bled together, night became irrelevant. I stopped locking the doors. I stopped going home. There was nothing waiting for me there. Nothing but hunger. The same hunger that thrummed through my fingers every time I peeled back skin. Not desire, not pleasure, just need. I think the body died, eventually. But that didn't stop the work. It continued. The tissue refused decay even without heartbeat, without breath. It remained pliant, warm sometimes. I would arrive to find incisions closed and sutures removed, bone exposed that I hadn't touched. I began operating without gloves. I wanted to feel the responses directly, the texture, the way the muscle shifted beneath my hand as though it knew what I was trying to do. And sometimes it helped. I stopped making incisions eventually. The flesh opened for me, parted at my touch, slow and deliberate, not torn or split, offered, like it wanted to be seen, and I obliged. There were others, briefly. Vagrants, addicts, people no one missed. But none of them responded the way he had. None of them listened. The body must be willing. I think it must want to be changed. Or perhaps it isn't the body at all. Perhaps it's something deeper, something that remembers. I saw it once, just for a moment. Deep beneath the layers of skin and fat and fascia, beyond the ribs, behind the organs, something watching. Not with eyes, not with malice, just there. A shape, a presence, like an echo trapped in tissue. I looked at it and I swear I felt it look back. That was the last time I cut. There was nothing more to learn. The work hasn't ended, it simply changed hands. I no longer hold the scalpel, I no longer need to. The flesh shapes itself now, with a precision that surpasses anything I could achieve. I feel it moving beneath my skin sometimes. Subtle, rhythmic shifts. Not spasms or disease. Design. I've woken to find incisions I never made, perfect and bloodless, following anatomical lines that I never studied. There is no pain, only function, and each one serves a purpose I have yet to understand. I think the body is correcting itself, not healing, but refining. I used to believe I was observing a transformation, that I was facilitating something external, but I was mistaken. This was never about the subject on the table. It never was. It was always about me. The dreams haven't stopped. If anything, they've grown clearer, less symbolic, more instructional. I see diagrams now. Surgical schematics I don't recall learning, names for things that don't exist yet, movements I have never practiced but feel in my hands when I wake. I no longer record them. There's no need. I remember everything. If this is madness, then it is an organized one, structured and intentional, and I have no desire to resist it. Not anymore. This isn't testimony. It's continuity. For whoever's next. Statement ends. The document was discovered in the basement of a condemned medical clinic in Newark, New Jersey, sealed with a rusted autoclave unit alongside a reel-to-reel recorder. Though the tape itself was heavily degraded, likely overwritten multiple times, only the transcript remained intact, typed neatly on hospital stationery, with no author or patient name listed. The clinic had been out of operation for nearly 40 years by the time of discovery. No death certificate or employment record could be found for a Dr. Adrien Halifax, though archived correspondence within Columbia University references a medical student by that name who was reportedly removed from rotation under unspecified circumstances in 1924. The letter is unsigned. The lower levels of the clinic were sealed by municipal order following a series of complaints regarding structural instability and persistent biological odors. Hazmat personnel reported finding surgical instruments arranged in precise geometric patterns with dried organic residue on most surfaces. No bodies were recovered. Of particular note is a single gurney in the center of what appeared to be a former operating theater. It was untouched by dust or corrosion, as if recently sterilized. A thin indentation, scalpel-shaped, was found on the tray beside it, though no tool was present. The metal shows signs of warping, as if exposed to sustained heat or pressure, though no source was identified. No medical explanation has been offered for these findings. Case filed under Anomaly Code H-047-Delta. Classification: Biophoric Entity. Status: Active, Sentient, Isolated, Disinformation Risk. Priority: High. End recording. The Obscura Dossier is a podcast created by K.W. Krieger, licensed under a Creative Commons Attribution Non-Commercial Share-alike 4.0 international license. If you enjoyed today's episode, please like, drop a comment, and subscribe. And as always, until next time.